about yourself?
Thank you for the opportunity. My name is Afifa Dewi Ayuningtyas. My age is 25 years old and I graduated from Polytechnic Kemenkes Yogyakarta, majoring in nursing in 2019. I have 1 year of work experience as a nurse in the pediatric nurse and 4 years as an ICU nurse at Sehati Hospital. I am an exhibition and I often take part in training for webinars on ICU nurse.
Okay, why did you choose nursing?
I think nursing is very noble job because it can help someone who needs help with health. I have decided to be useful to others and be able to help others.
Then, why you want to work as an ICU nurse?
Okay, Miss, thank you for the question. I want to become an ICU nurse because I think being an ICU nurse is not easy. ICU nurse need quite high skills and diligence. Because of this, I feel challenged to become an ICU nurse.
So, what skill you have performed as an ICU nurse in the past?
I have performed various activities in the ICU, for example, checking and monitoring vital signs every shift, bathing patients in every morning, taking care of diabetic mellitus wounds and decubitus, calculating and monitoring fluid balance, installing and monitoring ventilator use by patient, administering drugs through a syringe pump and installing infus stroke and infus pump, perform CPR on patient with cardiac arrest and respiratory arrest, and provide supplemental oxygen support.
Okay, why should we hire you?
I have work experience as a ICU nurse for 2 years at Sehati Hospital, so I already understand how the procedure as a nurse. I hope that my experience can be considered to be employed at this Jasmine Hospital.
Then, what is the strength you have?
My strength is I can do critical thinking is every analysis of the problem experienced by patient, taking into account the patient condition and needs, considering the positive and negative impacts of each action to be taken. What this critical thinking, I can prioritize patient problem according to their condition and needs and determine appropriate problem solving.
Okay, then what is the weakness you have?
I have a little trouble manage my time between work, tasks from the hospital, and activities outside the hospital, but I try to do and finish them on time.
Then define the critical thinking. How did you use critical thinking during your perceptorships?
Critical thinking is a person's ability to analyze the problem experienced by patient, determine intervention to find solution and solve patient problems, and prioritize patient problems according to needs and knowledge. As a nurse, I must always critical thinking in every matter to analyze the problem experienced by patient, solution to solve problems, and priority scale of patient problems.
Okay, tell me about a time you saw something unethical or not done correctly by another.
Okay, Miss, for the question, in my opinion, if there is a coworker who is doing the job incorrectly, I will try to reprimand him nicely and tell him where he is wrong and explain the possible impact that will occur if it continue and explain how the correct procedure is to be carried out.
Okay, it's case question. If you have an older patient that has been in bed 2 weeks, is short of breath, and has a respiratory rate 40, what do you do?
Okay, Miss, thank you for the question. The first I did was provide additional oxygen assistance using NRM with an oxygen concentration of 10 for 15 lpm. Then position the patient is a semi-volar because this position can provide opportunities for the lungs to expand and oxygen to increase to reduce shortness of breath. After that, an oximeter was installed to monitor oxygen saturation in the patient body and always monitor the condition of the patient vital sign.
Well, I think that's enough for today's the job interview. We will send the result of the interview within 1 week by email. Thank you for your attendance.
Thank you, Miss. I hope to be able to join the Jasmine Hospital.